I would like to introduce Luda. She is working with people with acute disability, and she describes the cases of two cases. And I would like to ask you, please describe the case, first case, clinical data, facts.
Okay, hello. I will tell the case of Valdes. He is our patient. It was for us for some time, and we get very good results. And I want to introduce these results and this case. So, he had a head trauma on 7th August 2010. He was hospitalized in the level 3 coma and had an urgent surgery. When the condition was stabilized, the rehabilitation started and lasted until the November 2010. And later, Valdes was in rehabilitation processes in Palanga, and together with him were the family members, and they also were involved in the general process of rehabilitation. Yes, during the first meeting, he complained about the partial control of the left side of the body. It was spastic plegia, residual left effects of a conclusion and contusion remained, difficulties in looking after himself, weakness of muscles. He moved his left leg in the hip and knee joint, however, the movements were poorly coordinated. There is full spastic in the left arm, so his conditions really was very serious. He has several contractures on the left elbow and foot. Cognitive functions were not disturbed. Yes, then after the process of rehabilitation, he already managed to sit in the wheelchair independently, but he was getting in and out of wheelchair with the support. He was taught how to do this by the physiotherapist, and with the parents' support, he started to move in the nearest environment. His feeding had no problem. Just when he was in coma, yes, the feeding was very special, and after awakening, he started to eat with the small pieces of food, but there were no special nutrition required. The sense of taste, the acceptance of different textures and the textures of the food were normal. Yes, then after he returned from the rehabilitation, he was involved in the rehabilitation process where the hypotherapy was applied, and twice a week he has sessions in Shuli University Hypotherapy Center with the specialists. They were working physical therapists and ergotherapists, and yes, he did a great success in the dynamics of the rebuilt physical functions. He started to use, not to use, but he started to use his hand, and but at the same time the legs were injured. He can't stand independently, and always he was using the wheelchair. His communication skills become better because he was motivated to communicate with the friends. with the staff, with the parents, with the relatives, and he was involved in the activities of NGOs for people who have acquired disability. So the general quality of life get better, and the maybe the most important result of our work was the fact that at the end of the hypotherapy session, after 3 months, he managed to stand up from the wheelchair and to do 5 or 6 steps with the help of with the support. So this is the case of Wilders.
And how you think, what's the most significant influence was in this case?
The most significant
Nutrition, intervention.
the most significant influence, I suppose, they were the first hours after the trauma, successfully done surgery, and then the process of rehabilitation that took everything, involved everything. The specialist team, all the team was working with him, and finally his as a factor of success is his emotional status, because he's really, when he was involved in the rehabilitation process, he get much more motivated to get in.
Thank you very much.
You're welcome.